Alexa, what's the weather today?
In Westchester, it's 70 degrees Fahrenheit with clear skies and sun.
Alexa, add cereal to my shopping list.
I've put cereal on your shopping list.
Alexa, play Hamilton soundtrack.
Playing Hamilton, original Broadway cast recording by Lin-Manuel Miranda from Spotify.
How does a bastard, or son of a whore and a Scotsman
Alexa, stop. Alexa, open OHDSI evidence.
Welcome to the OHDSI evidence skill. To learn about OHDSI, say info. To predict your COVID-19 outcome risk, say predict.
Stop.
Goodbye.
My name is Lisa Evans, and I'm a sophomore in high school at the Baldwin School in Pennsylvania. I will be telling you about how I created an Alexa skill for the OHDSI community so that you all can share OHDSI evidence with the rest of the world. Before I talk about the Alexa skill I created, let's first look at what an Alexa skill is. Amazon Alexa is a voice recognition tool. An Alexa skill is a way that computer programmers can create an interactive dialogue script that takes user commands, translates them into actions, and creates responses. Some skills are just information retrieval. Alexa, what's today's date?
It's Friday, October 9th.
Some skills result in some action. Alexa, add butter to my shopping list.
Butter added to your shopping list.
Some skills are interactive, such as the Jeopardy quiz game. My skill falls under this last category. The idea was to give the OHDSI community a new, innovative way to share reliable evidence with a broader audience in a more accessible way. For example, let's take the cover prediction model that was developed and externally validated during the OHDSI COVID-19 study-a-thon earlier this year. The OHDSI community used its open-source patient-level prediction framework to create a model for COVID-19. This model can tell people who are diagnosed with COVID-19 what their chance of hospitalization, requiring intensive service, or death is. The model was shown to be very predictive across multiple databases within the global OHDSI network, and was cited by the Health Minister of Catalonia, Spain, as a tool they may use to measure the impact of the disease. The work was prepared as a manuscript that was posted on medRxiv, and is currently under review in a peer-reviewed journal. The paper shows this nomogram, which lets a user answer a series of questions about their medical history, add up some points to get a cover score, and then map that score to a predicted risk. The team also made a website at data.ohdsi.org that allows users to apply the model where the same questions are listed and a user can check some boxes and submit their response. They then can get a bar chart with their predicted risk estimates. That was a great start, but I wondered if we could make it even easier for someone to use the evidence that OHDSI has created. So let me show you what I've come up with. Before I do, I should say the cover model only predicts outcomes for people 18 to 94. Since I'm only 15, I'm going to predict using cover to get a prediction on behalf of an 84-year-old male with hyperlipidemia, diabetes, and heart disease. To start, I will open the skill by saying the invocation name, which is the phrase that triggers the OHDSI skill. The skill can currently do two things: give information about OHDSI and predict your outcome risk of COVID-19 by collecting the info that the model needs. I will also demonstrate the skill's ability to verify and validate my responses to the questions by giving some invalid answers. Alexa, open OHDSI evidence.
Welcome to the OHDSI evidence skill. To learn about OHDSI, say info. To predict your COVID-19 outcome risk, say predict.
Predict.
Welcome to OHDSI's COVID-19 outcome risk calculator. This calculator presents the results of a prediction study that developed 3 prediction models. The 3 models predicted are hospital admission required, intensive services required, and fatality in the month following COVID-19 diagnosis. Your results from this calculator do not take the place of medical advice. Access to this information is for research and educational purposes only, and is not endorsed by any medical professional. Your results are not a substitute for medical care and should not be used in place of an appointment or the advice of your physician or another healthcare provider. You are responsible for any action taken through the use of this information. Say start when you're ready to begin.
Start.
How old are you?
84.
You said 84. Is that correct?
Yes.
What is your sex?
Male.
Have you ever been diagnosed with cancer?
No.
Do you have a history of COPD?
No.
Have you ever had diabetes?
Yes.
Have you ever had heart disease?
No.
Do you have a history of hyperlipidemia?
Yes.
Have you ever been diagnosed with hypertension?
Banana.
Banana is not acceptable. Please answer by saying yes or no.
No.
Have you ever been diagnosed with kidney disease?
Yes.
The predicted results of the three models are: you have a 10.9% chance of requiring hospitalization. You have a 2.4% chance of requiring intensive services. And you have a 7.6% chance of fatality.
So how did I make Alexa use the cover model? Let me show you how my Alexa skill works. There are two parts to it. The first part is the interaction model, which has the invocation name and intents. The invocation name is defined here as OHDSI evidence. Alexa will open the skill when she hears this phrase. Intents connect the user's utterances to the skill's functions that implement the actions. When the user says a command, such as start, the skill recognizes the intent and executes the function associated with it. Multiple utterances can trigger the same intent. There are standard intents, like stop or help, but I created my own custom prediction intent. This prediction intent follows a dialogue model that allows Alexa to prompt the user with questions and put the answers into slots. These slots act as variables and will be used later in the calculations. I added some validation checks for each slot to ensure the answer makes sense. The second part of my custom skill is the Python code. The predict intent triggers a function that uses the slot values to execute the model calculations and respond with the three predicted outcome risk values. I taught myself to write this code over the course of the summer, but now that I understand how it works, I know a similar skill could be created in a couple of weeks. In summary, Alexa provides a way for OHDSI to get its evidence out to all the people who could use it. I created the skill with two paths. First, to allow people to get information about OHDSI, and second, to use the cover prediction model. But it's possible to have many more paths. Together, we could build out the OHDSI evidence skill further to share the results of other OHDSI studies or allow people to predict other outcomes. I hope you'll join me in this journey.